Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Dave Chancellor, and I'll be your host today. For our webinar today, we're going to be hearing about Pathways to Prosperity and Well-Being, which is a pilot program with two Minnesota counties, Olmsted and Dakota, in conjunction with the Future Services Institute at the University of Minnesota. And I'm really happy to introduce our four speakers today. We'll be hearing from Paul Fleissner, who's the Deputy County Administrator for Olmsted County. Hi, Paul.
Hi, Dave. Hello, everyone.
Thanks, Paul. And Suk-Jin Ong, who is the Director of the Future Services Institute. Hi there.
Hi, everyone.
And Jenny Duville is the Pathways to Prosperity and Wellbeing Manager in Dakota County.
Thanks for having us.
And then finally, Lee Durbin, who's the Strategic Operations Specialist in Olmsted County.
Yes, hello, everybody.
Okay. So thanks to all of you for being here, and I also want to thank the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services for their support of this webinar series. That said, any positions expressed in this webinar aren't necessarily those of ASPE or the Institute for Research on Poverty. A couple quick notes on our agenda today. So I'll turn it over to our presenters in just a minute, and Paul's going to be starting us off. And they're going to cover a lot of ground today, and the presentation should take us right up about until the hour. So with that, Paul, Suk-Jin, Jenny, and Lee, thanks again for being here, and I'm going to turn it over to you now.
Thank you, everyone. This is a wonderful partnership. The University of Minnesota, Dakota County, and Olmsted County have been working on this together for a while, and we really want to change how the world of poverty supports go in our state and hopefully in our country. As you look at the agenda, we're going to cover our big, hairy, audacious goal, which for you good to great fans, we stole that concept as part of this. We're going to go through human-centered design process that helped us build a new practice model. We're going to walk through those practice models. We're going to tell you what we've learned so far. And we're going to talk to you about one of the strategies that is key to our success is a flexible benefit set that operates very different than our current system. And then hopefully some folks who have questions will stay afterward and we'll try to answer those for you. Who we are. First of all, in our state, we have a state supervised county administered system. So the state provides the rules and statutes, gives counties the authority to provide services to folks. There are 87 counties and 11 tribes that have that responsibility in our state. Dakota and Olmsted, you see us on that slide where we're located. Dakota is located near the Twin Cities, and Olmsted County is southeastern Minnesota. In terms of our individual counties, Olmsted County is kind of a service hub in southeastern Minnesota surrounded by agricultural counties. Mayo Clinic is the largest private employer in our state, and they're located in Rochester in our county. Dakota County is kind of unique in that they have a bit of urban, suburban, and rural aspects to their county. So what is very unique about both our counties, at least in our state, is how integrated we are. In Olmsted County, we have all the social services, public assistance, public health, community corrections, veteran services, and the housing authority in one organization. And we've been working for about 10 years to integrate those services across systems. Dakota County is set up very similarly. The one difference is they have the workforce center woven into their service set, and they do not have the housing authority. Both of us have close ties to those kinds of services in addition to our integrated models, but we've been changing culture in our service mix for a good part of about 10 years to have more impact on folks, to control those levers and integrate services. For us, what does that mean? We really work hard to integrate services to help people, families, and communities reach their potential, and the way we do that is working across those systems, and I'll give some examples later. In Dakota County, you see their values of making, being honest, fair, and accountable, or integrity, making others a top priority, challenging themselves to do things better, and valuing and respecting every individual. So what is this Pathways to Prosperity and Well-Being thing? Well, about 10 years ago, Kelly Harder, who was the director at the time in Dakota County, myself, and Frank Alexander from Boulder County in Colorado went to an event called Leadership for a Networked World at Harvard. One of the first things they did is prove to us we hadn't made progress on poverty in 40 years and call us to action. And there were 70 human service leaders at that event, state leaders, county leaders, city leaders, and a few international leaders. What emerged out of that from our 3 counties was this concept of pathways to prosperity and well-being. We wrote, Frank in particular wrote a white paper, and Kelly and I in Minnesota brought our counties together to look at how can we redesign our service delivery and public assistance benefits in a different way to make different impact. And we really focused on things like the social determinants of health. So we know our systems are impacted by complex needs: homelessness, domestic violence, substance abuse, child welfare, and then poverty in general. Historically, our systems have been very silo-based and difficult to work across systems. As we've built our cultures in these 2 counties, we've seen great results. I'll give you a great example in our county. We have the housing authority. We have moms, young teen moms who can't rent because of their age or no credit history. If they're homeless, what is their trajectory in our system? So our HRA is now doing master leasing to stabilize those moms, keep them in school. We bring family home visiting in to work with them on parenting, and we're seeing great results. It's just one example of having an integrated system where you can make different kinds of impacts. As I said, we are leaning heavily on this. How do we build supports across the social determinants of health? We know that folks thrive better if they have those basic things in place, whether it's housing stability, employment and income stability, what environment are they living in, how do we look at things like physical, mental, and emotional health. In Olmsted County, for example, we work with high-risk moms, and we have for several years, marrying family home visiting with intensive case management, and now more recently, because of our integration, housing and eligibility services. And we're seeing impacts already. So the 2 key pieces that we're changing in our system in order to have a different kind of experience for families is the, redesigning the service delivery. So we've built Pathways to Prosperity and Well-Being practice models. We've tested integrated whole family approaches. We've been prototyping, offering customized responses to the needs of these young families, enabling them to apply strengths, enabling us to apply strength-based systems and supports for folks so we can move them out of generational poverty. We're also redesigning public assistance benefits. We all know that there are serious fiscal cliffs in our system. We want to remove those cliffs. We also know that our benefits don't work together. For example, if a family has extra child care dollars because grandma can watch, can they use those dollars to stabilize their housing? Well, not in our current system. But in our project, those are the kinds of things we are going to test out. So, expected impacts in our project. We will intercept generational poverty. We're going to improve the customer experience. You're going to learn about practice model and tools we've built in partnership with the families that we serve that work better for them, are driven by them, and will have more impact for them. As we think about things like equity, I would make the argument that we built a poverty prison in our country. We have these fiscal cliffs. I'll give you an example, and I know they have one in the slides later, but a family of 3, a mom with 2 kids, hits that about $19.40, and that next dollar they earn, they start to lose rapidly more dollars than they're earning, up to about $8 an hour for the dollar they gain. And so we obviously have families who make decisions that are economic, and don't take that promotion, don't take that next job because it doesn't work for their family. It's our intent to wipe that out. But when you really think about our system and who is trapped in our poverty prison, it's families of color. And when you think about this whole system, you can really think about it as, have we really just extended a system of indentured servants? When you think about them coming to our offices for benefits, it's like a company store: food, cash, work, healthcare. They get all those things from us. How do we blow that up and start over and do something that works and moves people along? We want to close the company store and start something new that works based on the family's needs. And so we've got lots of partners supporting us. I'm not going to read them all, but Kresge Foundation in particular has funded a lot of this work. Our state of Minnesota has funded this work. We've built tools and practice models that folks are going to talk to you about. Suk Jin and her team at FSI have been absolutely key partners in helping us build the model that you're about to learn about. So with that, I'll turn it over to Suk Jin, and thank you all for attending today.
Thank you, Paul. Thank you for providing the context for this work. So I'm going to talk a little bit about the involvement that the Future Services Institute has with both counties, and it has been just such an enriching experience for us. So we are, the Future Services Institute is a center that's based off the Humphrey School of Public Affairs at the University of Minnesota, and a lot of the work that we do is on innovation, research, and evaluation in the human services field. And when we were first approached by both counties who want to embark on this bold and ambitious mission, we're like, yes, sign us up. Because oftentimes to really see the rubber hit the road, you need organizations that are willing to really challenge how the current system has been built, things that are not working, and things that are holding families back from living the life that they should be living. And so one of the key roles that we played in the initial phase is being a design partner and support in this work. So, you know, the counties have their own local expertise in really knowing what's going on at the ground, you know, from the frontline staff who do this work on a daily basis all the way up to the leadership that understands the contextual factors that can help shape how services in their respective counties come together. And so what we then play in terms of our role is to help illuminate some of that. You know, oftentimes when organizations such as both of these counties are busy delivering their services, you know, being able to have the opportunity to step back and observe and really understand what is that experience that the families are going through right now, then helps them do better in figuring out how might we actually incorporate this in a way that makes sense, that actually centers the voices and experiences of the families that are going through it. And that's really at the heart of this human-centered design process. You know, some of you might have heard of terms like person-centered work or design thinking. It's really very similar in that sense. And so, you know, from this particular model here that came from Christian Basin, really we begin at the exploration of what's the current space, like what is going on right now in the counties with their partner organizations, with the families. We spend a lot of time just listening, observing, immersing ourselves in that context. And I can go through a little bit more with the specifics of what is done in terms of the activities. But we spent a good portion of a couple of months here to just really listen to everyone and illuminate what is what's going on in both counties. And then the county spent a couple of months in this space of what's called generating alternative scenarios, where there were some ideas that were generated from just understanding what is and things that have been tried by, you know, say an innovative frontline staff who really wants to push things further. We then say, what if we put a little bit of resource and just, you know, like some processes to really see how might we try something different and learn from that experience and do better. If some of these ideas are ones that seem to yield, you know, better experiences for families, better experiences for the partner organizations or the staff that's doing the work, then how might we scale that? And then cumulatively, the different ideas, the prototypes that emerge from this then get, kind of integrated together, so to speak, in this practice model. So that's where we shift to that phase of enacting new practices. So how then you create the container as an organization so that these practices fit in just as, the new way of doing things, so to speak. And in doing this work, it's not just, the fun and creative stuff that you get to do, but also the courage to push against and to create space within, policy parameters, within whatever funding constraints that one might have, because we then have to figure out ways to bridge across all these different programs and funding streams that oftentimes ask for very competing things from each other. And yet the families, as Paul said earlier, have, require multiples of this. So how do we make sure that then in this new way of doing things that we try and relieve some of those administrative burdens, both on the families and also on the staff, so that, we do meaningful work together. And so that's really kind of that whole underpinning process that we have with the human-centered design work that we do with both counties. And in terms of when things happen, obviously there's the container, right, to the work. It doesn't just automatically happen. There's a lot of conversations to be had, creating the opportunity that needs to happen so that, an ambitious work like this can take place. So the leadership from both counties really had spent time tending to that field. Paul mentioned earlier that original conversation that happened with other local government leaders amongst folks that were part of APHSA. And then there was state legislation that was passed in 2017 to create that legal spaciousness to do this work, so to speak. And some of the initial work between both counties began. So, to the question of how might two different counties actually get something out of this together, right, is to figure out, where are some things that they both overlap in terms of what could be useful. What are some things that are uniquely different to both counties, and how can this process honor both, right, what's similar and what's different as well. And then what might be other tools that could be created where SFI could step in as an incubator so that we could help the development of these tools to support this new practice model as this thing come along. So we then spent an entire year together in this human-centered design process to really come up with what's that new practice model that we're going to embark on together. And since then, further work has happened as well. I mentioned earlier that there are specifics to the design process that overlaps in both counties. So among the things that we need to understand to understand the current space in both counties are things like one-on-one conversations with families, really understanding what their experience has been like, trying to navigate across the programs. We spend time in conversations, group conversations, and some one-on-one conversations with staff that do the work across different programs in both counties. We also had conversations where we have them share with us what are some stories of innovation. When was the last time we tried something different, because we know that makes the experience better for families. Tell us about that. We then map out some of these experiences, created personas and journey maps to help illuminate, this is where some of those, pain points of stuckness happen in the system. And yet, what are some things that are encouraging? Why do people keep coming back, and what makes their experiences better? So some of those things, the way in which a staff could be really thoughtful and attentive to the person's stories, advocating for them, those were the things that we hear a lot from these conversations. We then, use a lot of this too, coupled with things that are, as you would imagine, data-driven. So there were surveys done across the organization to learn from the staff, what does their workload look like? What might it feel like to work on some of these administrative burden pieces? We looked at data on demographics. We looked at, what are some of these characteristics of the people that were coming through the doors looking for services. We looked at literature out there across the field. What are experts in the field saying about integrated services or making sure that equity and the family's experiences get centered in doing this work? So we did a lot of that scanning in addition to the, direct observation and insights that we got from the people as well. We then did a lot of work with the counties to help surface potential ideas. So prototypes were created. Both counties were able to test out versions of, what might a new staffing configuration look like, what might a new tool look like, what might different ways of communicating with each other look like in their respective counties, and then refine that over time to pull together what the practice model now looks like. There are some things that were created jointly with us as well. For example, an assessment tool that we started out creating with Olmsted County that helps provide baseline information. There was a training that we created the manual for with both counties. So different pieces like that serves the collective interest of both counties as well. So with this, I hand over to Jenny and Lee.
Thanks, Jen. The Pathways target population is parents or expectant parents who are 30 or younger and on TANF, Child Care Assistance Program, or SNAP. While Olmsted and Dakota Counties have implemented the practice model in different ways, the values and characteristics are the same. We center the whole family as defined by them. This means we often support people previously unknown to our system, friends and family members critical to the success of the family, but not part of their household for benefit purposes. We focus on parents as individuals, and we also consider the roles they play. We focus on kids. What do they need to thrive? How can we support the people in their lives to provide that? We prioritize father engagement. We're intentional about seeing and supporting the culture of the family. We look for the line of interaction. How do families experience us, our staff, and our systems? How can we improve that? What belongs behind the curtain? How can we make our interactions easier for the family? Where are the transactions, and what's the opportunity for a more relational and transformative engagement? We ask families to define our relationship, and we do a lot of reframing. Relationships aren't a byproduct of the work. Relationships are the work, and people aren't intrinsically unmotivated. It's just that the conditions need to be realigned for motivation. We consider power. Who has it? Who's being preferenced by it? Do families fully understand their choices, the risks, and how we might manage them together? Have we explained all of the whys? We focus on integration. Are all parties aligned toward family goals, and are they working together? Are we providing the right support at the right time, at the right depth? Integration, after all, is not just about deep-end systems involvement. We are intentional about addressing all social determinants of health, and we look to them to find and understand root causes. We assume it's likely our families have experienced trauma, and we provide trauma-informed supports. We assume our families have scarcity mindsets. We understand how that influences patterns of thought and behavior, and we try to help our families see it too. We ask what's important for and important to a family, and we seek to balance those. We challenge ourselves to move up and out on the human services value curve, endeavoring to be regulative, but also collaborative, integrative, and ultimately generative. And we always start with the knowledge that families know best. They have enormous capacity, and they can be trusted. There seems to be a common assumption in human services that it's disrespectful to serve people without having everything figured out. We flip that on its head. What if it's actually disrespectful to try and figure everything out before we serve people? I hope you'll indulge my solar system metaphor here. Dakota County has implemented a practice model that orbits around the family. Our practice model is anchored by a core team that includes a generalist social worker, which is a new resource dedicated exclusively to our Pathways families without any other specific program affiliation, and a financial worker with a reduced caseload and an enhanced role in information and referral, as well as the maintenance of benefits. The core team offers significant proactive support to the family, helping them to understand and comply with the parts of the system that we can't change or contain behind the curtain. They work with the family to assess strengths, establish goals, and create a plan. If the family wants them to coordinate all of their services and supports, they do. If the family wants them to have a narrower focus, they do. The core team and the family work closely with an employment counselor who focuses on education and employment goals, and with a financial empowerment counselor who focuses on financial literacy, budgeting, reducing debt, and building assets. The broader Dakota County team supporting the family commonly includes a child support worker, a housing worker, a public health nurse, a transportation trainer, and a nutritionist. It may also include professionals from adult or child mental health, disability services, protective services, or community corrections. We partner closely with existing community supports for the family and try to help them establish new ones. The family determines which supports work in which constellations and in what proximity to them. We convene multidisciplinary team meetings as needed to prioritize and align discrete teams on a shared path.
Thanks, Jenny. Olmsted County's practice model is very similar, especially in our overall concept and it being a family or person-centered approach. This diagram here outlines for us how we look at what we're doing in Olmsted County. When a person comes through the doors at Olmsted County, he or she has the opportunity to develop an ongoing relationship with a social worker on our family support team. Through this connection, the person will receive warm handoffs or direct connections to any needed services, such as public assistance, housing, career development, or public health nursing. These direct and indirect relationships will all be customized based on the needs of the family and can be flexible to the family's preferences as a way to decrease administrative burden. The family and his or her social worker will jointly complete assessments to determine what services will best support them on their journey to self-sufficiency. One of these tools is called the Economic Stability Indicator, or ESI, and helps the social worker and family identify their unique fiscal cliff and how benefit options might change with life influxes. The ESI is predictive of impact changes on financial status and economic stability. The other tool that our team uses is called the Integrated Services Assessment Tool, or ISAT for short, and this is used as the foundation for the practice model as it encompasses the services the person might receive. The ISAT, this is a picture of the cover of the ISAT tool that FSI helped Olmsted County and Dakota County develop. This is, in its basic form, an assessment tool that was designed to be completed in partnership with the family. It offers a path for a deeper working relationship while identifying areas of strength and need. The ISAT is also responsive to different cultural backgrounds and perspectives. The ISAT encompasses the social determinants of health that Paul spoke of earlier and has a user-friendly format. Each domain within the tool includes a Likert scale made up of emojis and includes a large area for written text, diagrams or drawings, notes, or journaling. Following the assessment of strengths and needs, the ISAT also offers a space for goal planning. Another component of the ISAT is the caseworker record. This separate form is a way for the caseworker to document how the family is functioning and to track change over time. Another important part of our work is the rapid cycle continuous improvement process. In Olmsted County, this is a diagram of how it works for us. As we implement this new initiative, it's important for us to pay attention to how it's working and make the necessary changes as we go. We've established a process for rapid cycle continuous improvement, which allows us the opportunity to make revisions as the needs arise. In Olmsted County, 2 groups are regularly providing feedback through the rapid cycle continuous improvement process. The first group is the implementation team, which is made up of staff implementing the practice model. And the second group is the Participant Advisory Council, which is a group of persons receiving the services through the practice model. With this approach, we're able to get a variety of perspectives to guide decision-making. More importantly, this leads to the creation of a model that families feel they can engage in and be successful with.
Dakota County has a robust rapid cycle improvement process that makes space for reflection at multiple levels across all of the Community Services Division, as well as with community partners and the families we support. We ask people to consider the issues and trends we've identified, to identify what we haven't yet noticed, and to provide a fresh perspective on all of those. We're doing this rapid cycle improvement work with attention to each of the 6 conditions of social change, articulated in various ways by a variety of people, but taken here from the FSG publication, The Water of Systems Change. We agree that these are the key leverage points that support sustainable progress. And so we'll use this frame to discuss what's emerging for us a few months into implementation.
So the first piece on what we have learned are the things that are most explicit, and they all oftentimes revolve around policies, practices, and resource flows. From the perspective of the Future Services Institute, what we tend to see emerge from at least the things that we have done in both counties has to do with striking that balance, right, between what is required as policies, so kind of like what's expected of how a certain program is implemented, and then what actually shows up when a family comes to your doorstep and needs, you know, a multitude of things to get back on track, and oftentimes that reality doesn't quite look like the way a policy or a program is written in silos. And so being able to then, you know, listen to that experience of the family, especially from the perspective of the frontline staff, where they actually see what's going on, and knowing how to then thoughtfully and creatively braid and blend some of those experiences so that they are real and respectful and really centers the family is really key in shaping what this integrated practice model could look like for the future.
So in Dakota County, I would highlight a couple of things related to policies, practices, and resource flows. The first is that it's important to create a structure to listen and don't rely on it happening organically. The other thing is to question everything. If you think about the thing you're questioning, go back one step from that, and then probably another one.
In Olmsted County, I would probably highlight the importance of early communication with policymakers and funders to help us propel the implementation. And if you have specific questions about that, hopefully Paul would be able to answer questions at the end.
So at a deeper level, things that are not so implicit, so kind of go back one slide. All right. So with regards to relationships, connections, and power dynamics, that's really key in the work that we do in human services. So much of it is people-driven, right? It's people that's doing the work. It's people that's receiving services. And so some of the things that we have learned has to do with that relationship piece, being sure to have strong relationships, really spending time to get to know each other, really get to know what are things that we value in common, assumptions, and also having clarity and transparency when some of the things that emerge feels murky or unclear. And oftentimes, because of how hierarchical the systems can be, that leadership needs to model that so that everyone else could feel like they could do the same thing as well and have these genuine relationships to try something different.
We have to be intentional about developing, growing, and maintaining relationships. They don't just happen. I would also suggest that this is one of the hidden places where progress falters. If you're struggling and you can't figure out why, you might look to relationships.
It's also really important to remember that families are the ultimate drivers of their service provision, and their experiences and their self-awareness is really key to having effective services.
So that brings us to the things that are most deeply embedded in the work that we are doing, that is the implicit. So these are oftentimes the underlying mental models that drive the way that we do our work. And this is where at its most fundamental, because of how taxing the system can be on all that's involved, from the families to the staff who's doing the work, all the way to organizations that are trying to sustain this work with whatever resources that they're able to use, that we don't oftentimes talk about the good stuff, you know, the good work that's being done, the stories of courage and innovation and hope. So making sure that we uplift that and really highlight that, but also then see things that are not working as just symptoms of something deeper. So what are some root causes that we really need to tackle and really get to that? So not getting distracted by surface level things that are that oftentimes show up in this work.
Systems are made of people, but they're bigger than us too. People doing the work in our systems may feel defensive, thinking that we're saying they are the problem. And I think this is particularly true when we talk about mental models. We have to keep finding new ways to tell people that they are not the problem, though we are all on a journey together.
And along with that, when you move to a person-centered service delivery model, it depends on a culture shift with your agency, and it's very important to be patient with that. We found that providing structure, like through human-centered design and rapid cycle continuous improvement, having that structure to facilitate how people are exploring these new mental models is helpful in moving that culture.
The flexible benefit set is a key part of the Pathways to Prosperity and Wellbeing initiative, laid over the foundation of the practice model. The flexible benefit set was created in response to current public assistance benefits that are inflexible, inefficient, and unintelligibly complex. They do not successfully get people to a livable wage. Contrary to popular slogans, work does not always pay. And the current public assistance benefits seems to assume that poverty is about mismanaged money and bad decisions. Do you recognize these? They're tools, although old ones, sort of like these tools. They're old and they're single purpose. They probably worked pretty well for this family, but I'd suggest that they are now obsolete. This looks more like a family we support. Does this family use those old tools? Probably not, although maybe the record player. This family uses a new tool. It makes sense to have new tools for new times. This is why we created the flexible benefit set. In the current state, there are different sets of eligibility rules, applications, intake procedures, and in some cases, different agencies for each benefit. The flexible benefit set has a single set of relatively simple eligibility rules with streamlined application and intake processes. In the current state, there are discrete benefits with strict rules on how they are used. The flexible benefit set pools the benefits without restrictions dictating which dollars can be used for what. And in the current state, the cash benefit is given in isolation. The benefit is reduced when the sometimes arbitrary rules aren't strictly followed, and there's little ability to save. The flexible benefit set is paired with all of the support of the practice model. Arbitrary rules are eliminated, and there are cash incentives to save and complete education or training. This slide highlights a key strategy of the flexible benefit set. The outcome is a real livable wage. So let's look at a family of 3, 1 adult and 2 kids, 1 receiving child care. The MIT living wage calculator for Dakota County tells us that this family needs $566 a month for food. I think that sounds about right. They need $1,010 a month for child care. Good news, this is affordable if the adult is working a full-time job at the Minnesota minimum wage, which is pretty close to the federal poverty guideline. Oh wait, that's not affordable, it's just what they can afford. $550 a month to pay for child care, to pay for health care. Housing is $1,089 per month. Reasonable, but really difficult, even impossible. It will cost $868.83 a month for transportation. So this is car payments, maintenance and repairs, gas and insurance, so they can get to work, to childcare, and to medical appointments. They'll need $419 a month for household supplies and other expenses, and they'll pay $901.83 a month in taxes. This means that they'll need $31.18 an hour to cover their basic needs. That's 253% of the federal poverty guideline. We have to support families in reaching a real livable wage. This graph shows the benefit cliffs for that same family of 3 in Minnesota. The dotted gray line at the bottom represents earned income. The horizontal dotted black line at the top represents a living wage in Dakota County. The solid green line towards the top represents earned income plus a fully loaded benefit set, including health care, cash, food, child care, and a housing subsidy. There are a couple of places on this chart where work doesn't pay, but the biggest of these is in the left red circle. Paul referenced this. A $1 an hour increase in earned income results in the loss of $7.10 an hour in benefits. This family hasn't even made up this loss yet. When they get another $1 an hour increase in earned income, should be positive, right? But that results in the loss of another $3.50 an hour. They'll need to see an increase of about $8.50 an hour to make up the loss that they have gained, or that they sustained. So a maximum flexible benefit set amount would be calculated like this for this same family of 3. The cash or food grant is $985 a month. The average value of a housing subsidy in Dakota County is $929.40 a month. And the Child Care Assistance Program is valued at $1,382 a month and 88 cents. For a total of $3,297.28. So this is the maximum that would be available. If that family is earning $1,000 a month in wages, we would apply a 24% income disregard. (14% to account for the difference in gross versus net, and an extra 10% to incentivize work. Earned income after the disregard is $760. Subtract that from the maximum flexible benefit set amount, and this family would get a monthly grant of $2,537.28. Using this formula, we eliminate the cliffs, and you always make more money when you work. So what's next? This legislative session, we will ask the Minnesota legislature to grant waivers to exclude the flexible benefit set as income for the purposes of other programs, and to appropriate monies to fund part of the flexible benefit set for 100 people per year for 3 years. We hope to raise the additional funds for FBS through private foundations. More broadly, we will continue our rapid cycle improvement processes to continue refining our practice models. We hope to scale up and serve more families while understanding who sees the most benefit from our practice models. We will continue to find efficiencies and assess resource needs for this work. We're working to develop technology resources that enhance our model and allow us to implement the flexible benefit set. And we will continue evaluation of the Pathways Initiative. We're excited to pair the support of the practice model with the innovation of the flexible benefit set. We think this new pathway is a promising opportunity to arrest generational poverty. Thank you for your interest and attention.
Okay, thanks so much to the four of you. And I just want to remind folks that if you have questions for our presenters, we've got that Q&A box at the bottom, so you can just type in your questions, and we'll get to as many as we can as we have time here. But yeah, thank you again. As a first question, we have a question from Angela, and I believe, Jenny, you'd want to talk to this about what's kind of happening in Dakota County here. A little bit more about this role of the sort of the intensive role of the financial worker here. It's kind of offering advice and different financial management strategies and that sort of thing. Could you talk a little bit more in detail about what sort of that is looking like, or you're hoping for that to look like?
Absolutely. I think the first thing I'll say is that we are still figuring that out. That is a really active question for us right now, how much we can expand that financial worker role, how much that makes sense for both the family, for the social worker, and for the financial worker. Right now, the Pathways financial workers are doing I think what they would describe as a pretty significant amount of information and referral. So there are a lot of parts, a lot of things that come up in the course of their work with families that normally they don't have time to sort of engage and do a little bit of research and maybe even make a warm handoff. That now, with a reduced caseload and a little bit different expectation and a different view of the family, they are now able to dig into some of those other concerns. They're also able to take a more proactive approach to making sure that families remain on the benefits that they are eligible for, and they don't drop off because they didn't submit certain verification, or they did submit a verification but it wasn't the right one, or it didn't have someone's signature on it, or something like that. The Pathways financial worker is able to help support the family to stay on top of that, and to even the Pathways financial worker might reach out to someone to get that benefit for the family, or that verification, excuse me, if that's what would support the family.
Okay.
And in Olmsted County, I'd just like to add, I think we're a little bit further along in the implementation of our financial workers' involvement in the practice model. They're doing a lot more hands-on and meeting with the family in addition to the social worker, helping them to identify where they might get their verifications that are needed. Not afraid to just take the calls from the families directly instead of them going to like a phone bank per se. So I'd say it blurs the lines between like a financial worker or eligibility specialist and a social worker a little bit, but it's better serving the families.
Okay. Thank you. So for our next question, we're going to be here is from Jerica, and she's kind of asking about how these staff in different agencies that have traditionally been siloed and maybe not used to working together as much, how that's gone. A lot of times sometimes in implementations like these, there's some growing pains involved in that, and maybe Paul, would you want to start off with that? And I'd love to hear from everyone else too if you have thoughts too. Okay.
Yeah, this journey has been about a 10-year journey in terms of truly integrating across all these systems. and it didn't happen overnight. After coming back and learning a little bit about the human service value curve and the idea of an integrated service model, one of the challenges I have is I'm an idea guy, and if I come back and just whip something on folks, it's not just going to happen. So one of the things that we did is I brought in a colleague from another county in Colorado who had done some good integrated work and had her introduce the concept. She too had been at Harvard for the Networked World Institute, and got us thinking, and had all supervisors at that. And then I asked for some champions. Who's interested in us working differently across our systems? And so we went across our division, facilitating conversations. If we were to work differently across systems, what would it look like? And, you know, it took a few years to truly, and I have a group of champions called our Community Service Integration Team. And so we've been doing that for several years now before we got into this concept of totally changing our poverty system. And so it's been very intentional. It's been organic. Now, literally when we do orientations, we talk about your job is not just an eligibility worker or a child protection worker. Your job is to connect people to the network and array of services we've got so that families and individuals can reach their potential. And I think freeing people up to work differently, think differently, and bring ideas forward has been really powerful.
Lee or Jenny or Sukchin, did you have anything you wanted to kind of add to that? I'm sure you've got somewhat different experiences too, right?
Well, I'd say in Olmsted County that also we, in the human-centered design process, we also wrote out some process for some of these interactions that are going to help us with our evaluation and rapid cycle continuous improvement. And so by taking these relationships that we're trying to integrate and mapping out a process for how they're going to work together, that offers some structure and something for them to fall back on when they're maybe uncomfortable with this new way of working. And so as we're doing our rapid cycle continuous improvement, we can work through some of those discomforts with these changes.
Anyone else have anything they wanted to add? No, it sounds like we're good. So, I want to move on to our next question from Juan, and he's asking about how this might look different in rural areas. And I think maybe Lee, you could speak to this directly, because I know much of Olmsted County is more rural. I mean, I think there are sort of two parts of it. One, maybe where jobs are maybe less available, and also just kind of what it looks like in terms of distance to get to a service center where they're going to be able to access some of these resources and work with your staff. Do you have any thoughts about that, Lee?
Well, I'd say this is where having a family-centered approach comes in really, really well. It's because every family's situation is unique, and their employment opportunities are going to be, different based on their background and situations. Olmsted County, we have some of that rural environment, but we also are very fortunate to have access to a lot of resources and supports. We've brought in our employment supportive services staff from contracted agencies around the area to integrate into our practice model. And so having that support in addition to our traditional housing or I'd say public assistance expectations has been helpful in bridging that gap. I don't know, Paul, if you have any other.
Well, yeah, I would add to that in that even though we're rural, we have a really robust economy here. Mayo Clinic has grown a lot. Our community is growing a lot. We don't have enough employees, so we're actually at a point in time when opportunities are great if we can remove barriers. And to me, a lot of this work is getting the barriers out of people's way. We have also created pathways into high-need employment areas in our community, and Dakota has done similar work. And so, for example, we have healthcare, because obviously at Mayo Clinic we have 40-some thousand jobs. we have also built pathways into county employment because we need employees too. So I was actually just talking to someone who's gone through that path. So I think whether you're rural or in our city, there are still some barriers like transportation, but I think families can experience a pretty good set of services and get to where they need to go through this kind of process.
Okay. Our next question is from Jessica, and she's a legal aid attorney, and she's kind of concerned about the erosion of the appeals processes, especially state and federal level ones, that might come along with kind of a switch to a flexible benefit set. So once you take away sort of that individualized program, that becomes a little bit more murky. Is that something that you've looked at in the initial designs of these flexible benefit sets, or that you've dealt with at all?
I'm happy to take that on.
Okay, go ahead. There we go.
Well, first of all, this is voluntary. We're doing 100 families between our two counties so that we can prove the concept. If someone wanted to opt out, they could. I think since we've designed this based on what families want and that the whole process is human-centered and the tools and practice model are built around that, even with our early work with these families, I think they experience a much better system with much more flexibility, and we've guaranteed within our practice model they will not get less than they would have in the other system. They just can use it more flexibly. So we haven't heard of those kind of issues, but we did anticipate them, and that's why this is a voluntary program. People do not have to participate.
Okay. Do anyone have anything they wanted to add to that?
I'd only add that it's certainly a thing that we have been thinking about and talking about. So it's not a new consideration, and it really, it's at the heart of what we're trying to do, is make sure that families are supported, and to the degree that appeal rights are an important part of that, we're working on how to think about that.
Okay. Okay. I think this is kind of a broader question, because we have a few questions coming in that are sort of asking about implementation steps, and can you give us just a kind of a quick run through, and maybe Sukjin, you want to take this one on, of where you're actually at in this process, and kind of what things are going to look like as you get these sort of families ramped up, and what that looks like looking forward.
I think probably Lee and Jenny would be better at that. But from the FSI's perspective, the one thing that I would say is that there has been a lot of care to build that the capability and capacity to do and to put the new practice model into place that both counties took even before we were going live with that. So the training that I was mentioned, involvement and conversations with staff, figuring out how are the teams going to be structured and the linkages that are needed, tending to kind of like the behind the scenes stuff. But a lot of that was happening concurrently with before they started rolling it out with families. So there's a lot that goes into it beyond just like, all right, let's flick the switch and hit go, so to speak.
And Lee, did you have anything you wanted to add? And I'll go to Jenny next after that.
Can you repeat which question you were asking about?
Yeah, so I just kind of a quick kind of Cliff Notes version of where you're at in terms of the implementation and what that's going to look like as you're kind of say in the next few months here. I know you talked a little bit about that towards the end here, but.
Yeah, so I think we briefly touched on this on one of the key learning slides, but that part of our approach is just to start small, especially as we go through this rapid cycle continuous improvement work. So I think we're starting with about 10 families to get our feet underneath us, and then we're going to start opening the door to incoming families and continue to grow that over the next couple of years. But we're, with these 10 families and having that smaller population, we can engage with them in that participant advisory council so that we can, keep our thumb on how their interactions are going with each, aspect of our practice model. So that's about where we're at right now is, trying what we've planned and rapidly, making changes as we need to, and being avid learners of our customers.
Okay. Jenny, did you have anything you wanted to add? I'd love to hear about it. Sure.
This is some this is early ground for us to be experimenting with which parts of our intervention work best for which families, where we've sort of missed the mark, where something unexpected is happening or a new opportunity presents itself. I think we are in a space where every day we think about a new way to support a family differently and figure out how to try that and what are the important things to think about and do we have all the right populations and might that look different if it was a different family. And I think so we're enjoying this early time before we have a big scale up where we have to start formalizing a practice pattern.
Okay. And Jenny, as a follow-up question to that, you talked a couple of times about this sort of whole family approach, which is, I think, for a number of sort of social programs, has been a challenge as families start to look different, the number of people and who's in a household and who counts. What has been your approach? Could you kind of give us a little bit more detail about how you're incorporating, friends and others that are part of this family into this work?
Absolutely. We really, in one of our first interactions with a family, once they are part of the Pathways practice model, we ask them to define for us the people in their life who are critical to their success and who would, without whom they could not accomplish their goals. And in a few cases, that has been the benefit household composition, but in most cases it has not. In most cases there are, I think we have one family that there are two friends that were identified as being absolutely critical. Sometimes it's siblings or a parent that lives with the family or does not live with the family. And I think another part of that has been really interesting is understanding how to approach the fathers differently. We have fathers at all sort of levels of engagement, but we have a couple of fathers who have been unsure about how to engage and have been a little bit hesitant. And we've had to be really intentional about how to make it feel safe for the dad to be engaged with the family, how we can support him, and particularly how we might be able to support him if or when he has some distance from the family. Particularly, I think if that's purposeful, if he or some other family member wants there to be a little bit of distance, how can we still support him and keep him keep moving towards his well-being so that when there's some opportunity to re-engage with the family, he's in a better place to do that, and we've given him more tools and support to move towards that.
Thank you. So I think we're going to do two more questions, and as the second to last question here, and I sort of want to open this up to all of you, is just the question of scalability. I know it's really early in this process, and you're kind of still looking to see what's going to happen here. But I'm sure you've had conversations about what will this look like, moving forward. Is there, if it works well, what do you do to kind of make these things, what's the future hold there?
Well, I can jump in on that one. Part of the reason, or one of the things we need to make clear is that we talked about the flexible benefit set, but we don't have the dollars for that yet. It would take us the rest of my career to get the waivers needed to blend all these funding streams. And so we are hoping to get dollars from the legislature and then from the foundation community. Foundations have said they would step up, but they want to see some public dollars to fund this. But even for 100 families to duplicate the system is about $3.8 million a year. and we were close last year in the legislature. So one of the missing pieces is how do we getting this funding. We actually got through the our legislature last year, but didn't quite make it in the final bills. But we have a lot of interest. So I think in terms of scaling, we've got to prove the concept. We've got to fund the flexible benefit set. I think we're seeing gains even without the flexible benefit set, but the real game changer when it comes to the things that Jenny talked about with getting to a livable wage, overcoming the fiscal cliffs, isn't going to happen until we have that flexible benefit set fully funded.
Okay. Anyone else have anything they wanted to add there?
This is Jen. The other piece that I would add is that, it's so amazing being able to see both Dakota County and Olmsted County try these at the local level because, they're able to create that space for us to really see, what might really these systems look like is they were integrated and really centered around how families interact with the services that are needed, right? And as, a center based at the University of Minnesota, we are also tracking similar work that's happening, nationally, also in the state, other ways of that integrated services, definitely not at the way that the counties, both counties are doing this, but just different versions of that. So hopefully over time we're seeing, this trend in the human services sector moving towards one that really places the emphasis on that family experience, really making it about, how do we, serve them in a way that really helps them live better lives. And it'll be exciting to see over time, to see where some of these points of convergence begin with the different innovation work that's occurring.
Okay. And it's sort of a last question. I just want to ask, what this looks like moving forward. What are you excited about, and what things do you sort of have your eye on? And Paul, I know you were going to take this one for us.
Well, I think the real work's being done by the other folks on the line, and what I'm excited about is truly proving that we can move people out of poverty if we remove barriers. There's so many stereotypes. And I am committed after 35 years of work that we will create a support system that actually honors families, improves their lives, and allows them to make decisions that get them to where they want to go. Instead of being barriers, we really truly want our system to be support. So that's what I'm excited about, but the other team members might want to weigh in too.
Okay. Please feel free, okay?
I think we all share similar hopes and expectations here. Just a real, looking forward to seeing the fruits of our labor here, and the success of the families is really the reward here.
Okay. Jenny or Sug-Jin?
This is Sug-Jin. Well, I'm actually really excited to see the amount of people that joined us on this call today. Certainly something has piqued your interest in making you wanting to be here, and if you're doing similar work like this out there, definitely reach out. I think the more that all of us know of each other's work, we just kind of reduce that burden of starting from zero, right, and be able to make some real change in the system.
Okay. Well, Jenny, we've got to hear from you, so everybody else can talk now. So.
I think one of the things I'm the most excited about is the way our staff in the core team working the practice model day in and day out, the way they have responded to this work and the way they have grown in just a few short months. The kind of mind-opening conversations they've had with families. That in some, a worker told me the other day that she has done this work for like 23 years, and the conversations that we have through our rapid cycle improvement process and the various teams supporting families has just completely changed how she sees families. One of our financial workers has talked about how she really thought there was one particular family that she really thought she had a strong connection with and had worked with for a long time, and that Pathways has really opened up her eyes to what else is going on in that family's life and what it's like for that family to try and work in a county system. It's really easy to go through your job in county human services where you have a really high volume of work to do, and it's all really important, and it's really easy for those to become tasks, and you are sort of numbed to the people that you're supporting. And it's exciting to see people wonder about how they can support families differently and see what it feels like when the families respond because they felt that different interaction. So I'm super excited about what this feels like for our families and what this feels like for our staff.